Hi, Dr. Gellerman. How are you?
Hi, Fay. How are you?
I'm good. Thank you for joining us today. I'm really happy to have you on board talking about health
Absolutely.
and lifestyle. There's so many beautiful things that your practice does and is able to provide. I wanted to introduce you to everyone. So, hello.
Hi, I'm Dr. Ina Gellerman. I've been in Huntington since 2003. So I'm an orthodontist, and I feel that our office has been very well integrated with the local community. So in the times like that, it's really painful to see what everybody's going through. But at the same time, it is very exciting to see what Huntington people and the community doing to support local restaurants and to support healthcare workers that work nonstop at Huntington Hospital and Dolan Center and some other local places. So makes me even more prouder that I am one part of that community.
And I have to say, only because I followed your successes, but also you've given so much always and continue to give so much love and support to the Huntington community. And that's why you're loved by so many. And it's pretty amazing. And that's why, in times like this, people still have so many questions, concerns when it comes to orthodontics. And no one is as loving and familiar face as you are. So if you can kind of tell us what's going on, because you've had to shift your model, the way you're doing things with your practice, your patients, and even new patients. So those are kind of some of the things I wanted to go over today.
Well, we've always been in the front line in terms of technology, digital technology, three-dimensional X-ray printing, things like that. But I've never thought that how useful it can get one day. I mean, the reason we've been on top of it was not for pandemic for sure. But starting in mid-March, we have to shift everything to work off the office premises. So at this point, we are all connecting virtually, remotely to the office. We are able to do virtual visits with our patients. And next week, we will also introduce virtual consults to the new potential patients or to people that could not make it to their exams because we had to reschedule patients. And for people that are sitting home and want to know if they want Invisalign or braces, palate expander, they have sleep apnea issues, any appliances to improve their smile. So we are tirelessly working to set everything and follow up with everybody. Each day we send about 50 text messages to our existing customers, and then I get on the phone, Zoom, Google Hangouts, and I connect to them.
That's wonderful. So even while this is going on, and I know everything has kind of come to a standstill, but treatment still has to continue. And
Exactly. And patients, kids are home. This is the time where they have to stay. They have to be reminded all the time to stay on top of their hygiene, to brush twice a day, to floss, to avoid sticky, sugary food, in order to prevent any kind of breakage. People that wear an appliances like Invisalign, we want to remind them to wear them. Not, this is not the time to forget wearing them. The routine, I feel like some days you wake up and you're like, okay, I don't have to go to work today, there's no school today. And I've read some social media posts like, it's a new pajama season. But we have to, still remember that the life goes on and the appliances are active. And in order to take care of the teeth and prevent any cavities and move forward in the treatment progress, we have to stay on top of things.
so again, just picking up and relaying on the message, that we're seeing a lot of, medical professionals saying this is the time where you not only to stay safe, stay home, but you really use this as an opportunity to be the best health and wellness version of yourself, right? This is the time you want to upkeep.
Totally agree. To be quite honest, there is absolutely no excuse not to.
Yeah.
There's nothing else to do. You can wake up, you could do your own exercise. You do not need to be in the gym. You could walk around the block. You know, it's nice and quiet outside. Nobody's there. You can walk around your property perimeter. I mean, you could breathe fresh air. You could run around your property. It's safe.
Now, Dr. Gilman, do you find that any of your current patients have certain concerns right now with everything going on? Like, do you find them, first of all, I think it's so wonderful that you are able to, and you take the time, because it's not just your practice, it's just you care. You've become very connected with patients. I know even with my own children, my own family, we're a big family, and which is wonderful. That being said, do you find like there's a lot of questions, concerns that they have right now that it's great for even to you for you to address them right now?
It is absolutely true what you just said. People don't know. I mean, there's uncertainty on what's going to happen tomorrow. There's uncertainty if the school's going to open up this season, and it's definitely they're not sure what to do with their current orthodontic situation. For those patients, our patients that are being treated with Invisalign, like a clear removal treatment, everything's been pre-treated for you on the computer by me, so it's all custom made. So if you're in the middle of the treatment, I can connect to the office. I can see which trays you're supposed to wear, and we can mail you the trays. We do not have to step a foot at the post office. Everything's done online. It is easy. We track the packages. We unfortunately do depend on the post office. Couple of packages said it was delivered, but it wasn't. But we can reorder them and redeliver them. And all of our patients with Invisalign are super happy. They all continue in treatment. For those that are done, you know, but didn't get their appointment to be seen to evaluate if they're ready for retainer, or if they need to order more sets, we can always make them something, order them like a passive tray just to keep them from like reshifting.
But so from what I'm gathering, which is fantastic, is don't panic, don't get frustrated. You
Exactly.
have the options, there's the solutions, still able to continue with your treatments, still able to work to maintain and to get to your final results. And
Exactly.
you're pretty much, you're there, you're available, which is wonderful. It's a huge reassurance across the board. In terms of maintenance, just maintaining whatever in terms of treatment, or any tips, I guess, anything you want to point out?
So in terms of maintenance, it's really important. Brushing, of course, twice a day at a minimum, morning and night, flossing, rinsing. We've read online, American Dental Association printed a couple of research papers that this particular virus is not withstanding peroxide. So there is Colgate Peroxil. You could rinse with that. You could rinse with, make a mixture of peroxide 50-50 with water and rinse with that. Just keep your teeth clean. That's the bottom line. If you're having retainers or clear aligners, you could also soak them in a mixture of peroxide and water, again 50-50 for 15-30 minutes, just to keep it clean. Wash and rinse everything very well, and we always recommend to use toothbrush and warm water and soap to brush the retainers as well. And I do strongly recommend to change your toothbrush more frequently during this time.
Well, very interesting. That's why it's very important to hear from our medical professionals, such as yourself, because just proper, easy steps help maintain, keep it going, and keep getting towards your results. Now, here's one. I have a question, because a lot of people say, "Oh, I've heard the peroxide, but does Listerine work just as well? Can you soak your retainer in Listerine? Is that something you recommend?"
Listerine does have alcohol in it. It does not have peroxide in its mixture. This particular virus I read is more sensitive to peroxide, so I would say Colgate Peroxil might be a better option, but Listerine works great for the gums to prevent gum inflammation. So I would suggest you do not hurt yourself if you do use Listerine at least once a day, and use Peroxil a second time when you brush, that's fine.
You read my mind. That was my question. Could you use both simultaneously? So that would
Absolutely. Absolutely. It doesn't, if you have it at home, it does not harm you.
Beautiful. I wanted to ask you on a great ending note. I mean, you gave us so many tips, so many options available, so many wonderful things that I think it was important information for people to get a hold of. Would we be able to visit you back and kind of see as you're virtually meeting with your patients next time?
So when we're virtually meeting with a patient, we have few different options. We have a HIPAA compliant text messaging when you could send us pictures for review, like somebody who's turning palate expander. I review the pictures every 10 days and give them recommendations to continue. We also meet through like Google Hangouts and Zoom. If I want to do a review of a hygiene or review of a progress or instruct on wearing rubber bands or things like that. And again, if you run out of rubber bands or you need wax or anything else, we can always mail it to you. So just text us or call or email. On our website, there is a chat feature. It comes to me as an email. A few of us all day long monitor it. So we are pretty quick to responding.
Wow. That's thank you so much.
I know it's a frustrating time for everybody, so the least we can do is at least to be able to respond, connect to people, put them at ease, and make sure that we can take care of them.
I have to say, not only thank you for joining us today, but more importantly, because I belong to many different groups, and some of the complaints, whether it's orthodontic, dental, they don't get a response. And they get frustrated and they don't know what options or what's available, what to do at all. So I'm so pleased and happy that you're staying connected.
No, we all, our job is to take care of the patients, and especially, there's nothing that I can do right now to help them orthodontically, but at least I can give them moral support and other ways of supporting them. Like if there is a financial issue, we're always going to be with them every step of the way to help them. If they're unable to pay their bill this month, we'll help. It's just reach out, talk to us, and we are here to help in any way we can.
Wow. Thank you, Dr. Gellerman. Thank you. God bless you. That's pretty amazing.
Oh, thanks.
Especially you're here in your own way for being patient and being there to help people. Thank you so much.
Thank you, Faye. Thank you. For us, it's always great because it's nice to hear your voice. When I reach out to patients and you start talking and you go back and forth to what you talked when you were back in the office, and and everybody's saying, I can't wait to be in the waiting room, and it's little things that we live through every day and we don't appreciate. So at times like that kind of takes us back to say like, oh my God, I really miss you. I miss the human touch. I miss the hug, the kiss, the handshake. I can't wait to go back to it. I know it's going to take a while, but I'm sure, it will happen.
We'll all be here. We'll all be patient. We'll get through this together. We're staying connected together. On the last and final note, I wanted to tell you just exactly what you said, how it hits home. My son was who was my youngest and is one of your patients, was so happy to receive that text from you. But it also gave him a quick reminder to make sure he's wearing his retainer as much as he's supposed to be. So he was so happy, he's excited. And I'm like, are you wearing? He goes, I'm wearing my retainer. I know. So that was good. Keep it
Listen, it's little things like that we always have to be reminded, especially times like that, because the priorities shift. And sometimes you think, do I really need to follow up with that? But yeah, we do. Like everything else, wear your retainers, wash your hands now more than ever before you take them out and before you put them in. Rinse them with water and soap, and that's it. You're good.
Thanks, Dr. Gellerman. I'm glad. Thank you for putting a smile on our face today, but also thank you for that our smiles are in your hands.